Hi, you're watching Your World Tonight here on Wion. I'm Aisha Sindhu. With the demand for organ donations on the rise, India finds itself at the crossroads of long waitlists, loophole-filled laws and an alarming increase in the illegal organ trade. Take a look at this report.
In June this year, a kidney transplant racket was uncovered at a hospital in India's capital, Delhi. A month later, an illegal kidney transplant racket was busted in Hiranandani Hospital in Mumbai. Illegal organ transplant and organ trafficking remain major concerns in India, where the demand for vital organs such as kidneys far outruns supply, leading to long waiting lists. The Transplantation of Human Organs and Tissues Act gives legal sanction to only 3 types of organ donation: by relatives, including parents, siblings, spouses, or grandparents or grandchildren; by others who can donate as a charitable gesture with no financial conditions; or swap donors with another family when relatives' organs don't match. Otherwise, the sale of organs is a punishable offence. Yet the alarming increase in the number of illegal operations has underscored the need for transparency in organ donation. The government has put up a portal which showcases records of transplants in the country. Still in its early stages, the site shows donations only till the year 2014. In a study done in 2007, the World Health Organization stated that around 2,000 people in India sell their kidneys each year. While no formal study has been done since the WHO report, the number of kidney rackets uncovered this year alone suggests that illegal trade is on the rise. Many loopholes, growing waiting lists, India's problems with organ transplants are multifold. The road ahead is long, but an efficient and transparent way out of the conundrum is the need of the hour. Bureau Report, Wion.
To talk more about the illegal organ trade in India, we're joined in our studio by Dr. Manoj Kumar Singhal. He is the Director of the Department of Nephrology and Kidney Transplant at the Fortis Hospital. Thanks, Doctor, for joining us here. We appreciate you taking out the time. Let's start with a basic question. How severe is the situation as far as the illegal trade goes?
Yeah, it is quite important. As it was mentioned, there is a discrepancy between the demand and the organs which are available for kidney transplant. Just to give you a glimpse of numbers, in India, almost 250,000 people develop advanced kidney failure and they require dialysis or kidney transplantation. Of this large number, only 10%, that is 25,000 patients, reach hospital and they are started on dialysis. And of this, approximately 5,000 to 6,000 patients get kidney transplantation every year. Most of these transplants are by living kidney donation and mostly by the family members, immediate family or extended family. There is a small amount of swap transplants which are done where the donors do not match. Some part is because of illegal kidney donation, which is they buy or sell their kidneys for monetary gain.
Right.
However, with that law in place, this number is progressively going down. Off and on we hear such reports of these rackets which are caught by police, and then there is a curve on these donations.
But I think the concern is not just about the fact that, these few cases come up in the media, but I'm certain that there must be a number of cases that are also going unreported when people are, selling their kidneys because of financial requirements, and because of this dearth of organs available, that trade is obviously going to continue to thrive. What do you think?
Yeah, obviously, whenever there is a discrepancy between the demand and supply, some way out will come up. So there are maybe number of unreported cases, as you said, will be going on, and off and on they get caught.
So you mentioned that very high numbers as far as kidney failure and kidney disease goes in India. Can you tell me exactly why that happens? What is it that makes India more susceptible to diseases of nephrology?
No, it's not that Indians are more susceptible, but over the world we see more and more patients developing advanced renal failure. And predominantly, it's because of changing lifestyle and increasing prevalence and incidence of lifestyle diseases. If we look at the causes of kidney failure, the commonest cause of kidney failure is diabetes. And we know that the number of patients who develop diabetes is progressively increasing. And India probably is the capital for diabetes, being a high population and the increased prevalence of diabetes in India. So, most of these patients, say almost 25 to 30% of these patients at some stage will develop kidney failure and will require dialysis or transplant.
Okay, I'm going to use that phrase that we all heard when we were growing up, that prevention is better than cure. Do you think that then, dealing with the diabetes problem in India is also part of the solution when it comes to illegal trade?
Of course, if we decrease the incidence of renal failure, the requirement for kidney transplantation will go down. And that trend has been seen over the time in the world. The US data, which is recently reported in 2013, has shown that after 2006, there has been a slight decrease in the number of new patients who develop kidney failure. And predominantly, this is the result of prevention of diabetes and prevention of kidney failure in these patients who have diabetes.
All right. So, clearly there's a lot of issues at play over here, and I'd like to come back to the focus of our discussion today, and that is the illegal trade. And why is it that there's a shortage of donors? As you're pointing out, there is a discrepancy. As the law stands right now, I'll take the viewers through that, by relatives including parents, siblings, spouses or grandparents / children, by others who can donate as a charitable effort without any financial consideration, or swap donors with another family when relatives don't match. Do you feel that these recommendations or these stipulations, let's call it that, are adequate to deal with the discrepancy as you're pointing out?
So, these recommendations are definitely well thought about and they are adequate, but the problem is the corruption. Say in the law there is a provision of somebody, if say there is a no donor in the family, somebody who is emotionally related to the individual, and if he is trying to donate on his own will, can donate. But the problem is there are no hard and fast rule to see whether he is really emotionally motivated or there is something else which is motivating this individual. And whenever such rackets are caught, the doctors or say transplant coordinator, they become the easy target. Many times we also see even people forge relationships. We have seen a spouse coming up as kidney donor, whereas they are not real spouse. So, people forge the documents, they forge the relationship and they come up to the transplant center for transplant. How to control this menace? Who is responsible for that? Whether the patient is responsible, donor is responsible, the doctor who is treating these patients is responsible, or the hospital where the transplant is done, they are responsible. So, who is accountable or responsible for this type of forged documents or forgery? So, that is not controlled, and that is the reason most of the doctors, they are afraid of doing these transplants. They flatly refuse that the patient where the relationship is very clear, has been documented by tissue matching, there are adequate papers to support the relationship, these are the people who will be accepted for transplant.
Okay, so there's a number of layers as you're pointing out. Perhaps the media doesn't always pick up on these finer details as far as these rackets go. You talked about this emotional connect, and that is one of the stipulations as you're pointing out. In terms of suggestions on how organ donation can be improved to deal with, I'm sure numbers must be a big problem when it comes to India as well. How do you perceive that changing, and what would you say are the sort of amendments that are needed to the law?
I think law is already in place, only thing is the implementation. There should be a very clear cut rules which govern these laws, so that there is a clear cut responsibility on individual. Say if somebody forged a document, usually the patient or the donor, they come up with these documents. So, the responsibility should be put on the people who forge these documents rather than putting the responsibility on the medical system.
Okay.
Number one. Number two, the law should become lenient. If somebody is willing to donate the kidney and he is willingly donating, there should be a procedure to document this willingness adequately, and he should be allowed to donate. Number 3, there may be more awareness. Say many times we see that the family members, although they are healthy, they can donate, but because of ignorance or some sort of fear, they don't come up for donation. So, if we have more awareness in the society that the kidney donation is safe, then probably more and more people will come up for donation from the family. And 4th is the system to get cadaveric donation in place. Lately, over last 3-4 years, there is more and more cadaver donation. We should take the example from Tamil Nadu. The number of disease donor transplantation has greatly increased in Tamil Nadu. So, in fact, last year I guess they have done almost 750 kidney transplants from disease donor, and this year probably they will cross more than 1000 kidney donation. So, that is the way to go, and that is the only thing which can bridge this gap between demand and supply.
Okay, but one category that was missing in what you just listed was medical staff as well. Do you think that there is also, you're pointing out that there are instances where maybe doctors are blamed incorrectly, but what about responsibility on the part of the medical profession when it comes to dealing with these cases?
In cadaveric donation, I think the medical system has
No, I'm talking about other organ transplants. And because these are expensive operations, there is a give and take that takes place. Do you think that perhaps doctors need to reduce fees, hospitals, private institutions need to ensure that these are more readily accessible also, so people come across to institutions like yourself to carry out these procedures above board?
Financial constraint, I don't think is a major hurdle. For example, the kidney transplantation is relatively competitive surgical procedure. So, I think the need of an hour is to develop more and more of such transplant facilities in government hospital. If we look at the number of transplant done, almost 80 to 90% of these transplants are done in private hospitals. Most of the government institutes do not have a facility for kidney transplantation. So, if we have more and more such institutes performing kidney transplant, so overall the unit cost will go down. Even in private hospital, there are now medicine cost has come down. The medicine has become more cheaper because of the government intervention and other market forces.
Sure.
So, the overall cost of maintaining kidney transplant has become quite less.
All right.
So, I guess with time it will get better.
Okay, when it comes to talking about ignorance as far as these surgeries goes, I think there's also ignorance when it comes to people who want to become organ donors themselves. Do you think that more needs to be done to encourage people to say that they don't want to be an organ donor on the occasion or the unfortunate incident of a death? And is India ready for perhaps an organ donor registry like the likes that the United States or perhaps other Western countries have?
Yes, I think that's what awareness should be there, and the media can play a major role in it. So, if only the people who have some patient in the family understand the importance of kidney transplant and kidney donation. If nobody in the family has faced such problem, they are quite unaware of this problem. So, if there is more awareness about this demand and the supply of organs, people know that once there is irreversible damage to the brain, that is the stage when the patient is brain dead, and they can donate organs at that stage. There are a lot of organs which can be donated and which can give a lease of life to many other people who are suffering from those diseases. So, that awareness campaign should start from very beginning. In fact, school syllabus should have that type of awareness chapter in their books in biology, where they are taught about this type of disease pattern.
What about advertising campaigns? If you remember, watching Indian television back in the 90s, you would always see, this campaign for donating your eyes.
Yes.
But of late, really, that momentum seems to have been lost. Do you think the governments also need to step in at this point?
I think the eye donation, like they have put in the campaign for eye donation, now most of the people are aware of eye donation. And the peculiar thing about eye donation is the tissue donation. Even the eyes or cornea can be retrieved after the cardiac death of the patient. whereas the organs can only be retrieved when the heart is beating, but the brain is dead.
Sure, okay.
So we have to increase the awareness, and we should have to put in place the similar type of campaign so that people are aware of brain death stage and they are willing to donate their organs at that stage of life.
Okay, doctor, when it comes to, perhaps the attention that's needed, of late we saw India's foreign minister Sushma Swaraj herself requiring, a donor for a kidney transplant. What about the VIP tag? How big of a function does that play? Does it help you jump the line when it comes to, if you're on the list as someone who needs an organ?
There are guidelines from the government. NATO has put the guidelines in place how this priority for the kidney. This is in the context of disease donor transplant.
And
so
only
who should
kidneys
be given?
or all organs?
All the organs,
Okay.
all liver as well as kidney. There is a waiting list, and who should get the priority? What should be the scoring points? So it's a point-wise system where each patient is assigned points, and whosoever is on the top of the list, he gets the organ. So that type of priority is there in cadaveric kidney transplantation.
But how does one come to the conclusion that one person is more deserving of a transplant as opposed to the other? I mean, there is that whole question of ethics within the medical
That's where
profession.
these NATO guidelines are in place. So the patient who has been on dialysis for longer period of time, patients who are younger, say below a certain age, patient who has had a previous kidney transplantation. So these are the criteria which they have devised, and they have given points to these criteria, and that's how the patient gets a score.
Okay.
So if patient has been waiting for kidney transplantation on dialysis, for example, say 2 years, so he gets the priority in getting a kidney than a patient who has just started dialysis.
Okay, we've talked about perhaps the updates that might be needed for the law as it exists now, but when it comes to these guidelines, do you feel that even these need to be relooked at?
They have to be refined with time. Like in US, this is the usual system which was followed earlier. Now they have a matching system where they see how they can best utilize this kidney. So they give a scoring to the donor. How good is the kidney, whether the kidney is coming from a young donor or is it coming from an old donor, whether the donor had diabetes or high blood pressure or any other problem, and accordingly they give a scoring to the patient, and they match these two scores and see where the kidney can be best utilized, for how long this kidney is going to work, so that they can maximize the use of this kidney. So that type of a system has been adopted in US. So I think with time we have to refine these guidelines and this scoring system and best utilize this rare, say scarce resource.
Okay, doctor. So as you're pointing out, there is a number of a number of issues that need to be addressed. It's not really all black and white. There are shades of grey when it comes to the proliferation of the illegal organ trade. In closing, if you had to tell our viewers what it is, the one big factor you think is still missing as far as for lack of a better word, speeding up the process of people receiving organs when they need to, what would it be?
I think there should be more awareness. People should be aware that there is a need for organs and it's a harmless procedure. So the family member who are healthy, if they can donate the kidneys to their near ones, that will help. Number two, the corruption. In overall society, there is a lot of corruption, and most of the schemes fail because of that corruption. So if people will stop or say decrease forging the documents or forging relationships, system will become more transparent, and these emotionally motivated donor can be accepted more in numbers. So I think these are the two areas which should get better in living donor kidney transplantation. And third is the legal paperwork and the well-defined rules which will put the accountability on the person who is forging the documents or relationship, so that they can be penalized rather than just penalizing the whole community which is involved in kidney transplantation.
Okay, fair enough. I'm being told that I have time for one more question. So let's talk a bit about a state that you brought up, Tamil Nadu, which seems to be doing something right. What exactly do you feel Tamil Nadu has been able to achieve that should be a guideline for other states to follow?
I think it's a willingness from the government, because one of the secretary or the official at that point of time has seen such problem in their own family perhaps, and that's how he developed this system of kidney transplantation. So they have a well defined registry, they have well defined centers which can retrieve organs, and these organs are allocated to these patients who have been waiting on the list, and they now fly organs from one city to another city, one state to another state, and they utilize these organs in the maximal possible manner.
And is the public-private relationship in this case a successful one as well? How much of the onus is on the private sector as well?
No, they have a well-defined system in place. So they have centers which are providing dialysis on a no-profit, no-loss basis, and they have these centers where you can retrieve whenever there is a potential donor. They inform state organization, and they retrieve the organs for that. So I don't think money is any hindrance in that system. So it's quite transparent and well defined system to share these organs.
So the government will carry it forward by private enterprise as well is the successful formula as far as Tamil Nadu goes. Dr. Singhal, thanks so much for joining us here in the studio. You've given us some interesting things to think about when it comes to the question of illegal trade of organs in India. India continues to see a number of operations go wrong across the country when people don't have the sort of information that they need. As the doctor was pointing out right now, it is awareness campaigns across the country pushed by the government and taken forward by informed citizens as well that is going to prevent the illegal organ trade from flourishing in India as we go forward into 2017 as well. We're going to wrap up this edition of Your World Tonight on that note. I'm Aisha Sindhu. Do join us on the other side of this short break for more news and updates. See you later.